Any discussion of dermatology is going to have to begin with a brief overview of the histology of the skin. So going from the surface of the skin all the way down to the base, we have several layers that you really should remember for step 1. A common mnemonic device to remember this is Californians like girls in string bikinis. So CLGSB. Californians, or C, is for the stratum corneum. L for like is going to be the stratum lucidum. G in girls is going to be stratum granulosum. The S in string is stratum spinosum. And the B in bikinis is stratum basalis. So Californians like girls in string bikinis, easy mnemonic device to remember the layers. And again, those layers are the stratum corneum, the stratum lucidum, stratum granulosum, stratum spinosum, and the stratum basalis. A little bit of information is necessary for you to remember about each one of these layers for step 1. In terms of the stratum corneum, it's important to remember that this is the top layer of the skin, and it's constantly being sloughed off. So you're losing literally thousands and thousands of cells from this layer every single day. Now, these cells in the stratum corneum, because they're being sloughed off, the vast majority are already dead. And as dead cells, they do not have any nuclei. So these are anucleate cells. They're composed of a very large amount of keratin. And that keratin helps you keep your skin sort of waterproof. Now, certain parts of your body may actually have an increase in the amount of stratum corneum compared to other parts. And usually we call these calluses. So you might have calluses on your hand or from your feet from overuse. And all that is actually an increase or hypertrophy of the stratum corneum. Stratum lucidum is next, and there's nothing in particular you need to remember about that for step 1. Stratum granulosum is the next layer. Again, nothing in particular until we get to the disease processes, and certain diseases do affect stratum granulosum, and we will discuss those in the future. Stratum spinosum is the next layer, and at the very bottom, we have stratum basalis. And stratum basalis is where the stem cells live, and this is where new cells are going to be regenerated. And just beneath the stratum basalis, we have the basement membrane. And the basement membrane is basically an extracellular matrix structure that is going to separate that epithelial cell layer, the stratum basalis, from the underlying connective tissue in the dermis. So that's a brief overview of the epidermal layers, and you're able to see on your screen now a picture of what these look like. So make sure you're familiar again with the order of these layers for step 1. Now looking at this on more of a microscopic and even electron microscopic level, we're going to look at some of the cell junctions that help to connect the epithelial cells to one another and also to help the epithelial cells communicate with each other. So going from the most superficial junctions all the way down to the deepest junctions, we're going to start with the zona occludens. Now, zona occludens are also called tight junctions, and the reason that these are so important is that they sit at the very, very surface of the skin, so they're the most superficial in terms of the different junctions connecting epithelial cells, and these are important because they prevent diffusion across the paracellular space. So you can envision that if this is sort of connecting different epithelial cells very close to their superficial surface, it's going to prevent different substances from leaking down and getting in between the epithelial cells and that interstitial space. So you can think of these as sort of a border that blocks any paracellular diffusion. These are composed of claudins, and claudins are just a certain type of protein. It's an adhesive protein that helps to keep the cells stuck together, and also proteins called occludins. And the occludins, as the name implies, are going to help block any substances from diffusing in between the cells. So zona occludens tight junctions are composed of claudins and occludins. Next, we have the zona adherens. And the zona adherens is also known as an intermediate junction. Now, these junctions are going to lie just beneath the zona occludens, or the tight junctions. Now, these intermediate junctions, or zona adherens, are actually composed of cadherins, which connect to actin. So the way this works is that the cadherins are these adhesive molecules that sort of stick out, and they line the middle of this paracellular space in between the two different epithelial cells. And those cadherins are responsible for connecting each epithelial cell to the one next to it. Now, how do the cadherins do this? They do it by binding to actin filaments inside each cell. So the cell's actin binds to the cadherin located in the paracellular space, and thereby are able to join each cell to one another. Now, the cadherins are going to be calcium-dependent adhesion molecules. Now, that's important to know for step one, and should be easy to remember just by thinking about cadherins, calcium-dependent. So they both have a Ca at the beginning of the name. So cadherins are calcium-dependent adhesion molecules. Now, one common point of confusion here is going to be how to remember the difference between zona occludens, which is the first one we talked about, and the zona adherence. The way I like to think about this is going to be that cadherins sounds like adherens. So in the zona adherens, we have cadherins as the molecules that are holding the cells together. And in the first part we talked about, the zona occludens, we just have claudins and occludens. So claudins and occludens in the zona occludens. Then in the zona adherens, we have cadherins as the adhesive molecules. So again, zona adherens sounds like cadherins, and that's how I remember that cadherins are located in the zona adherens. Now, if we go one layer lower, we're down into the macula adherents. Now, again, this is going to be confusing because it sounds very similar to the one we just talked about, the zona adherens. So how do I remember this difference? Well, remember that the first two different types of junctions we talked about were the zona occludens and the zona adherens. So the two that begin with zona are located at the top of the cell. So it's zona occludens and then zona adherens, those are the top two. And then we move on to macula adherens. So remember, the two that begin with zona are the two most superficial of the different types of junctions. So the macula adherens, this third type, is also known as a desmosome. Now, the desmosome, or the macula adherens, is the most important of these junctions in terms of literally sticking two epithelial cells to one another. Now, the desmosome is also composed of cadherins, just like the intermediate junction or zona adherens, which we just discussed. But in the macula adherens, or the desmosome, these cadherins, rather than connecting to actin like they did before, are now connecting to intermediate filaments. So the difference again between macula adherens and zona adherens is that in the zona adherens, you had your cadherins attaching to actin. And now down here in the desmosome, where the macula adherens, we're going to have the cadherins connecting to intermediate filaments. Now, one other important molecule you should be aware of as a part of the desmosome is called desmoplakin. Now, desmoplakin is actually the molecule that attaches to the intermediate filaments in each of the two cells that it's joining. So it's sort of like a sandwich, and the way you can envision the sandwich is going to be that in the middle of the two cells, right in between them, so in the middle of this desmosome, you're going to have a cadherin molecule, and the cadherin molecule is, again, the one that's sort of the adhesive molecule. Now, in order for the cadherin molecule to get linked up to the intermediate filaments in each cell, it does this via using desmoplakin as a bridge. So the sandwich goes cadherin, then desmoplakin, then intermediate filament. And that's happening on both sides of the desmosome, obviously, if we're going to be hooking up two epithelial cells to one another. Now, importantly, there's a disease called Pemphigus Vulgaris, where the patient actually develops autoantibodies against the desmosome, or the macula adherens. And as you can imagine, this is going to cause epithelial sloughing. Now, we'll talk about this disease in more detail later in the course, but for now, just realize that these autoantibodies are going to affect the desmosomes. Now, just beneath the desmosome, or the macula adherens, we have gap junctions. Now, gap junctions are important because they actually allow both electric and metabolic communication between two cells. So you can think of these as open channels that basically allow the two cells to communicate with one another. Now, gap junctions are composed of proteins called connexons, and these connexons are going to have a central channel that allows flow to go back and forth between the two cells. And then finally, at the very bottom, or the deepest part of the epithelial cell layer, you're going to have the basement membrane. Now, as I already said, the basement membrane is composed of some extracellular matrix that serves as sort of a barrier in between the epithelial cell layer and the underlying dermis, or connective tissue. Now, the way that the epithelial cells are going to get anchored to this basement membrane is through something called Hemi Desmosomes. So Hemi Desmosomes are going to connect cells to the underlying extracellular matrix. And if you have autoantibodies against these, the Hemi Desmosomes, you actually develop a different type of pemphigoid called bullous pemphigoid. And again, we will talk about bullous pemphigoid in more detail in a later lecture. The important part in terms of ultrastructure of the Hemi Desmosome for you to know in step 1 is that the Hemi Desmosomes are doing their job via something called integrins. Now, integrins are molecules that you can think of as essentially connecting all of the underlying extracellular matrix to the epithelial cell by way of the basement membrane. So in order for this basement membrane to connect the epithelial cells to the underlying extracellular matrix, you're going to need integrins. So the integrins are going to make up the Hemi Desmosomes, and all of that is used to connect epithelial cells to underlying extracellular matrix.